Hello, Philippine NARS listeners and followers. Kumusta po kayo? I hope you are doing well. And as you know, Philippine NARS is brought to you by PNANV, or the Philippine Nurses Association of Nevada, in collaboration with PHLV Radio. The episodes are available where you can get your podcasts. And now we are also streaming on Fil-Am TV. So thank you for joining us today. So we have a very interesting topic today that is Oriental Medicine. So Oriental Medicine, also known as traditional Chinese medicine, is an ancient medical system that encompasses a variety of traditional health care therapies. It has been used for more than 3,000 years to diagnose and treat illnesses and prevent diseases and improve the well-being of people. So here in Las Vegas, we have an educational institution that teaches Oriental Medicine, and that is the Wongu University of Oriental Medicine. So today we have invited the president of Wongu to talk to us about Oriental Medicine. And so please let us welcome Dr. Sang-Yun Lee. Welcome, doctor.
Thank you for inviting me.
Of course.
I'm very nervous.
Oh, you are? Oh, don't be nervous. Don't be nervous. That's okay. You're fine. You're fine.
Okay.
So, Dr. Dr. Lee, here I'm making mistakes now, earned his master's from South Balo University. That's in Anaheim, California, right?
Oh, yes, you're right.
Okay. And his DAOM, which stands for
The
Doctorate
of
Acupuncture
and Oriental Medicine.
And Oriental Medicine.
Yes.
And you earned that from the Emperor College, which is also in California, in Culver City, right?
In the Santa Monica.
Santa Monica?
Yes.
Okay. Well, it's close by. Close enough, right? Yeah. So he is licensed both in Nevada and in California as an acupuncturist. And also you have worked previously in the psychiatry department?
Oh, yes. After I got the license, I was very luckily able to meet the psychiatrist, Dr. Robert Chang, and then able to start practice my acupuncture and herbal medicine in his psychiatric clinic, which is called the Insight Choices.
Oh, Insight Choices. And so, so what brought you here to Las Vegas?
Well, after I work in the psychiatric clinic, pain management clinics, physical therapy, or the chiropractic clinics in Los Angeles, I was kind of curious about how I can be more involved in the education setting.
Yes.
Then I applied to the Wongu University, started teaching the online and in-person classes, and then had an interview and got appointed as an academic dean, and then later got the president too.
Very good, very good. So, welcome to Las Vegas. How long have you been here? A few years?
It's about 3 to 4 years.
3 to 4 years.
Yeah.
Okay. All right.
I like here more.
Oh, yeah. It's more fun over here.
Yeah. Feel more comfortable.
And cheaper.
Yeah.
Okay. All right. So, explain to us what Oriental Medicine is.
Oriental medicine is basically understand the patient's condition in the Western medicine concept with Oriental medical theories. As a practitioner, we apply the acupuncture treatment and herbal medicine treatment to influence the patient's condition.
To influence the patient condition. So basically, you still look at the Western medicine, but you're integrating the Oriental medicine, which is... There's a lot of things. There's a lot of components about Oriental medicine, right?
That's why in our program it's about 4 years of the education to get the license of Oriental Medical Doctor degree.
Degree.
Okay. Oriental Medicine, the OMD license in the Nevada.
In Nevada.
In our the master program, we have almost 30% of the Western science and clinical medicine classes.
Okay. Okay, so we'll talk more about the master's program later, but can you tell me what is the difference between Oriental medicine and Western medicine? Do they have, why should one consider one over the other, or vice versa, or?
I usually recommend my patient to go together to when they want to come to the Wongu Health Clinic for the acupuncture and herbal medicine treatment.
Okay.
But still, like the follow up with the Western doctors to check the condition also.
Okay.
And most of the Wongu Health Clinic patients, they have been going to the hospitals or nearby the Western clinics, and they want to have more non-pharmaceutical approach. They want to utilize their own some healing system through the acupuncture treatment and a organic non-pharmaceutical approach, which is the herbal medicine.
Which
too.
the herbal medicine goes through. Okay. So I'm pretty sure that a lot of us have, in one way or another, dealt with some of the components or traditional treatment modalities of Oriental medicine. So would you explain to us what is acupuncture exactly?
Acupuncture is using the hair thin needles.
Very, very thin needles,
very
right?
thin, using the very thin needles. So the patient was very afraid, feeling must be a more painful during the treatment. But most of the patient, they don't feel any a pain during the treatment. Acupuncture treatment is to adjust the muscle tension, pain level, pain frequency on the particular musculoskeletal concerns, and based on our meridian system, which
The
is
meridians,
linking the group of the muscles on the outside to each different internal organs. So it also influences to some other internal medical concerns too. Based on my some personal experience also, acupuncture and herbal medicine is also influencing those psychological concerns, including the somewhat reduce the
anxiety levels. Okay.
Depression levels,
Ah.
and secondary insomnia levels.
Insomnia. Okay.
Yes.
I might have to come to you for acupuncture. I know I have never I have never been a patient, of acupuncture. My daughter does it all the time. So anyway, and she swears by it, by the way. Okay, so what about herbal medicine? Talk to us about herbal medicine, because I know there's a lot. I watch a lot of Chinese dramas, and in the ancient times you're like, oh, there's this herb and how do you know that it's a poison? So I'm like, okay, I'm sure that has now become more modern. So I'm like, how do they how would you remember all this stuff?
Well, that's why the program is almost 4 years, and repeating the many terminologies and then contents here and there. And herbal medicine is basically when the patient is next to me, then I do the acupuncture, cupping, other modalities. When the patient is away from me, then I want to give the somewhat similar influence. So we use the herbal medicine. Herbal medicine is basically understanding of the herbs in some Oriental medicine, the theory background perspective, which is very similar as some thinking about the weather. Whether on the outside is either very cold or warm, very dry or very humid, very windy or very stationary.
Okay.
Based on this, that we understand each different herbs in this understanding as a weather. We also understand the same concept in the patient's condition too. So this patient has too much heat and then too dry. Then we use the herbal medicine to cool down,
right?
And then to a little bit more to moisturize.
Oh, okay. So it's based individually then.
Based
Okay,
individually.
very good, very good. So there is a treatment modality called
Bastion.
Bastion. Can you explain about that?
Yeah, there's very also common modality in the Asian communities. The three modalities are very common: acupuncture, moxibustion, and herbal
And
medicine.
herbal medicine. Uh-huh.
Acupuncture is using the very thin needle to stimulate the ligament or the muscles. And moxibustion is the dry herb. Looks like a kind of short cigar
Okay.
with the safety panel. Then attached
Okay.
on the surface of the skin.
Okay.
So it warms the local area, and then through this the herb oil penetrate to the skin, induce more the immune reaction.
Oh, okay. All right. Well, I have to look at that too. No, I've seen it, but I've never really seen it on a modern time thing. So
I
that's
see,
good. That's
I
good.
see.
Okay, so what about cupping? I know there's a treatment modality called cupping. And so can you explain how that's done and what are the benefits of cupping?
Some group of the Wongu Health Clinic patient, they're somewhat scared about the needles. Then they also get the cupping session only. Cupping mechanism is somewhat opposite of the massage. Massage, acupressure is somewhat squeeze in, directly disrupt the local soft tissue.
Okay.
Isn't it? And then cupping is opposite, create the negative pressure, pulling out the surface of the skin. So in the deeper tissue level, there's more empty space, isn't it? There's more vacancy to readjust there the tension, and has more chance to regenerate the micro level of the blood vessels to reduce the pressure and tensions.
Oh, okay. So I have heard and read that a lot of Olympic athletes or even athletes use cupping, right?
Yeah, so in the somewhat swimming, the athletic, they also show the like some of the
Right.
cupping mark, isn't it?
Yeah, we can see the cupping mark sometimes when they go for their events, right? So do they do that like right before they have an event or maybe a day or so? Because I think the cupping rings stay for a while, right? I mean, it doesn't disappear right away.
If the local circulation is great, then those cupping mark, like it looks like a red circle,
Yeah,
isn't it?
red circles, right?
It disappear immediately. If the local circulation is poor, and then muscle local tension is like a very high, and then local the body temperature is also very cold and very low, then the cupping mark stays for the several days.
Oh, wow.
So it's up to the local condition.
Okay, so it's individualized, really, actually. Wow, that's amazing. And I know that a big part of Oriental medicine is also looking at nutrition, which we're coming into March, which is Nutrition Month. So how do you teach that from an Oriental medicine standpoint?
We utilize the yin and yang theory and the climates.
The yin and
related,
yang theory,
And
okay.
then based on the yin and yang theory, there's like some climate theory that I just explained to you.
right.
Is also one of the Oriental medical theories too. So not only we teach the Western nutrition relevant to some certain component has the certain effects, but also we understand each different like a nutrition in the same way as the herbs.
I see.
So not only we also provide the herbal medicine based on the patient's condition,
Based on the patient.
but also the use the same the list of so I will say the grocery the shopping lists. So certain types of the meats, vegetable or fruits, or the rice or the other the
Carbohydrates or
carbohydrates,
vegetables, right.
So we suggest certain foods to follow, other foods to avoid, because in the Oriental medicine, when we think about the herbs, we are teaching 200 single herbs.
Wow.
Everything's organic and green. but each one has their own purpose and different treatment plan and directions. We understand that this nutrition same as the herbs.
Same as the herbs. Okay.
Each one has their own direction, so must be some only group of the organic like a food might be relevant to this condition, not
The
for
condition
this.
of the patient. So it depends on each individual patient what their condition is, and based upon those, you would recommend certain things, components like carbohydrates, vegetables, or whatever, akin towards their specific need or condition.
Yes.
Correct?
Yes.
Okay, I get it now.
Thank you.
Okay, so what about Tai Chi and what is that?
Qigong?
Qigong. Those are movements, right? Now that's very
Yes.
popular. And
Yes. So our Oriental medicine, one of the big fundamental root is the Taoism.
Taoism.
What is relevant to the more like a meditation, isn't it?
Okay.
Meditation is not only controlling the breathing, calm down and reduce the stress level, but also somewhat the energy flow through the meridian is to be more facilitated.
Okay.
Qigong and Tai Chi Chuan is somewhat like a more active style, the movement to utilize our each joint and then balance of the each different muscles together to have more the full body balance
Okay.
with the breathing control.
Yeah. People are telling me, hey, go do Tai Chi. Do you know of any groups do you have organized groups for this here in Nevada, or do you do classes yourself?
In our master program, we have Qigong class and then Tai Chi class.
Wow. Wow. That's pretty awesome. So the other thing is massage. I think you call it Tuina. Okay. Do you teach that as well as part of your curriculum?
In the part of the curriculum, we teach the Tui Na. The Tui and Na is the Chinese word that we push and pull.
Push and pull.
So we push certain muscle and pull the certain muscles to adjust to have a balance to each other. And we also have another class called acupressure.
Oh, okay. Yeah.
We teach each acupuncture point location, and there the relevant energetic like a function also. So after we teach, and then what we teach is the acupressure class. So before we use the needles or the moxibustion, we also use our hands to stimulate each different acupuncture points.
Yeah. I talked to one of your people a few years ago, and I think for gastric, it's like here in the earlobes. I said, how does the earlobe connect to the gastric? But it's a point of a pressure point, right?
Another class called the microsystem.
Microsystem.
In the Oriental medicine theory, we think the surface of the ear or the scalp or the palms or the bottom of the feet is the miniaturized map of the whole body.
Oh.
So we also teach each different point on the surface of the ear relevant to each different part of the body through this the vagus nerve system. So we stimulate the certain point based on the condition also.
I would say that was very beneficial to me because I was having some gastric issues at the time, and I think they put in a couple of I don't know if you call it patches, but I had to keep it there for a few days, and it really helped. So it did.
Thank you. Not only we use the very small size of the needles, but also we use it's called the Wongu, the very small seed, somewhat half size of the rice size, and then with the sticker we place on
that's what it was.
Certain point on the surface of ear, isn't it?
Oh my goodness.
Very interesting because recently we see the many veteran patients
Veterans.
Veterans in the hospitals. Most of the VA, the Wongu patient, they experience the ear acupuncture in the VA hospital.
Wow.
So many people told me that they had the good benefit on the ear acupuncture in the VA hospital. That's why they consider more acupuncture treatment.
Oh my goodness. Well, we're learning a lot today.
No.
So thank you for that, Dr. Lee. So in order to administer the above treatment modalities, you have to, of course, be a licensed practitioner of Oriental Medicine, correct? And what training does that entail?
So somewhat like some medical school or dental school, pharmacy schools. Acupuncture school is about the 4-year program.
Okay.
Consists of the Western science, Oriental medicine theories, acupuncture, and then herbal medicine.
Oh,
With
okay.
1,000 hours of the clinic internship training.
Wow, that's a lot of hours. That's like half a year.
Yeah, so consists about the somewhat average 4 years. So after finish the program, then take the national exam. And if you want to practice in the Nevada, then take the Nevada Oriental Medicine Board exam.
Okay. So you don't have a, what do you call that? Like if you were licensed in California and passed the exam there, you have to take another exam here in Nevada?
Yes, especially the California is a little bit different from the other states.
Okay.
California has their own acupuncture exams. So I'm also from LA. So after I get the California acupuncturist license, and then with my master degree program and doctoral the program, the credit hours.
Yes.
And additionally, I took the national exam, which cover the most of the states
Many
in the
different
US.
states. Okay.
So we utilize that national the exam and then those school credit hours. Then I apply the Nevada Oriental Medicine Board.
Oh, wow. Okay, well, that's a lot of education, and it is compared to training for a doctor. I'm sure it is. Yes, right. So, tell us about Wongu University of Oriental Medicine. What degrees do you offer to be a licensed practitioner of Oriental Medicine?
Wongu has been in the Vegas since 2012.
2012.
So
right?
somewhat about 13 years.
Yeah. Yeah.
And so far, we have a little more than 50 alumni.
Wow.
And then what we offer is the Master of Science in Acupuncture and Herbal Medicine.
And herbal medicine. Okay. All right. So, speaking of master's degree, you were talking to me a little bit about the master's degree that you offer, especially for nurses, right? And you can do it online. And tell us about that. And you still have the practical portion of it, right? So.
Interestingly, most of the Wongu current students, their academic background is accounting.
Accounting. Wow.
Hospitality. Very different from the nurse
Yes,
and Oriental
yes,
medicine,
yeah.
isn't it? So we're also introduced our program to the local public, not related to the somewhat the natural science or the medical science, but when we also have several nursing background,
Ooh,
PA background, the alumni too. That's why I wanted to introduce the program to the nurse community.
The nurse community, yeah.
Because about 30% of the Western course from the general biology, chemistry, anatomy, pathology, the clinical medicine will be overlapped with the nursing school education, isn't it? So
okay.
as long as they have been practiced, and those credit is transferable.
They're transferable.
So they don't need to take the general biology class again.
Sure. Okay.
then those the about 4 years of this the program can be shrink to.
Can be shortened to like 3 years, maybe.
Yes.
Yeah.
So what we want to present is you don't need to change your life. Keep all your the work in your life while you're taking the Wongu classes online on the weekdays, and some of our the in-person classes like hands-on technique classes, and about 1,000 hours of the clinical internship. Then come to the Wongu for those the in-person and clinical internships.
Oh, okay. So you have your own simulated lab in there, or do you actually have patients that they can look at?
Wongu consists of the 3 different buildings:
Okay.
school building, clinic building, and herb building.
Herb building.
So in the school building, obviously we have in-person classes. In the clinic building, we have clinical internship. So during this program, students are able to directly observe the other practitioners' practice, and about 700 hours of the direct practice, clinical acupuncture treatment, moxa, cupping, and herbal medicine training within our the program. Under the licensed supervisors' advice.
It's kind of like a clinic practice for nursing and doctors as well. So that's good. That's good. So how long does it take for until one considers himself or herself to be a master of herbal medicine?
So to complete the program, average is about 4 years.
4 years, yeah.
However, I think I can take a little bit more number of the classes than other people. And I think I can utilize our quarter break since we're the quarter system. So between the quarter, there's about 2 weeks of the break, isn't it?
Yeah.
So utilize the quarter break. Then it also can be shrink to the somewhat about 3 years too.
3 years, okay.
However, because there's so busy with the current job and also to support the family, many other reasons. If they take the less number of the class than average, then it also can take 5 or 6 years.
Well, yeah. So and that's good. And a lot of schools consider that actually. Of course, you're not just like, for example, in the Philippines and probably even in China, when you're a student, they send you to school and you don't work, right? So, but here it's a little different. So, yeah, I'm glad that you all tailor make or being open to the fact that people who actually come and enroll to your school have other different things that they're doing. So, that's good.
I believe the TV show is on the Philippine also. I see.
Yes.
Because we also accept the foreign students.
Oh, you do? Yeah. This podcast is going to be streaming at Fil-Am TV and soon on Sky TV in the Philippines. So you hear that? Nag-accept po sila ng foreign students. So maraming online po. So you might want to check it out. Okay. Okay. So what are some of the precautions that they need to watch for in, let's say, suggesting herbal medicine?
The first thing is that when we think about the herbal medicine, it's not about someone using the more expensive herb for the better effects. It's not about there's like a price or other thing. The most important thing on the herbal medicine is the diagnosis.
The diagnosis. Okay.
Understand the patient's condition more specifically.
Okay.
We teach the 200 single herb, 160 combination of the herbal formula.
Oh my God, I don't know if I can take that. 200. So yeah, it takes a while, I guess, for you to get acclimated to
be more specific, be
Yeah.
more accurate, needs a more the
Right.
repeating the training.
repeated.
Not
Okay.
only this the didactic course memorized to take to pass pass the classes, but also during the clinic internship, how we can utilize this the knowledge from the didactic classes, how I can
To actual
really
patient care.
actually the patient care.
Yeah,
Yes.
yeah, because not everything in the book is specific for a patient. So that's great. That's great. So when one starts Oriental medicine treatment, do you recommend only staying with Oriental, or you still make it like they can do a combination of Western medicine and Oriental medicine? Correct?
Obviously, combination.
Combination. All right. So how does one enroll with Wongu?
The first requirement is the bachelor's degree in any major,
In any major? Okay.
including accounting is also because the most of current students are from the business, accounting, or hospitalities. So that's the first requirement.
Okay.
Second requirement is the people who graduate from the non-English speaking the countries, they need the TOEFL or other English proficiency
TOEFL.
tests.
Okay. So they have to take TOEFL. You have to have a bachelor's degree of somewhere within, not necessarily healthcare, but others. Okay.
There's no admission tests.
Okay. All right. And you said you also have a clinic, the Wongu Health Center. Can you tell us about the services that you offer?
Last 2-3 years, we changed to the Monday through Saturday.
Monday through Saturday?
About 8 a.m. to the 5-6 p.m.
Okay.
Our clinic has been very successful.
Okay.
Number of the patient become almost triple than last
Wow.
year.
Great.
Using the number of the herb is almost 10 times more than the last year.
Wow.
So our growth of the clinic is like a very steep.
And you have to, it's based on appointment, right?
Yes. So based on the appointment, and patient can choose either getting the acupuncture and herbal the treatment by the clinic intern students
Okay.
under the supervisor, or direct treatment by the licensed practitioner.
Licensed practitioner. Okay, very good. Well, we will learn more about this master's program, and I guess you can just go to Wongu website, www.wongu.edu.
.edu.
Okay, and then learn more about that program. Let's see. So we are encouraging you to actually check that out, right?
Yeah, thank you.
Okay. Oh, you're welcome. And what is your message to the public about Oriental medicine, and your message to the healthcare professionals who would be interested in taking up Oriental medicine?
First, people who is interested in the somewhat non-pharmaceutical approach, alternative, complementary the medicine.
Okay.
Among in this alternative medicine, Oriental medicine has a very high credentialing. We teach the Oriental medicine what the Department of Education want us to teach.
Right. Right.
We're very careful on the quality control and then contents to teach.
And that's important. Yeah.
And clinic practice wise also, people need to have a license from the California, Nevada OM board for the Las Vegas and other the Nevada area.
Okay.
It's also very carefully managed too.
Okay.
So among the alternative medicine, we have more higher standard and then
Higher
credential.
standards.
Hmm.
Wow.
So if you're somewhat interested in the non-pharmaceutical, more the natural and organic food
Holistic
perspective,
type
holistic
Right.
type interest, then Well, it's okay to keep it as a hobby, but if you want to utilize as your the another part of your the career, then acupuncture and herbal medicine career also can be very realistic option to consider.
Ah, okay.
I feel more confidence on the last 2-3 years. I experienced the Wongu clinic has been very successful. We launched our herbal the dispensary room, so we manufacture the organic herbs by ourselves.
Wow, that's awesome.
We start from the one formula. Now we have almost 70 liquid form. The formulas are ready.
Wow.
We're going to expand more in the future too.
We're going to have to come and take a tour of your facility.
We'll love to. We'll love
Yeah.
to.
So, wow, that's very good information. So, Dr. Sang-Yun Lee, thank you very much for gracing our program today to tell us about Oriental Medicine and, of course, Wongu University of Oriental Medicine. So, for those of you nurses who are interested in taking the master's program for Oriental Medicine at Wongu, please go online at www.wongu.edu to learn more about the program. Or you can call 702 was it 563-2122, or you can just call Dr. Lee here.
Very available. Yes.
Yeah. And Wongu University is located at 8620 Southeastern Avenue, Las Vegas, and it's 89123. Okay. So just so you all know that Wongu University is the first and only university approved in the state of Nevada to offer the Master of Science degree in Oriental Medicine, correct?
That's why we also promote the online system.
The online system.
We're the only one in the Nevada and surrounding 9 states,
Oh,
like
good.
Utah, Idaho, Montana, those area.
Yeah,
Their acupuncture clinic is very successful.
very good. Very good.
But there's no school. That's why we
There's
also
no
want
school.
no
Yeah.
school in those states. So we also want to be more friendly to the students who live in the other states.
In the other states. Okay. Well, very good. Very good. Well, thank you again, Dr. Lee, for coming to our program today. And that was a load of information that a lot of us don't know, actually, including myself. And to our listeners and followers, we leave you with this. Oriental medicine aims to restore the balance and harmony in the body by considering the natural opposing forces of yin and yang, and includes practices such as acupuncture, herbal therapy, meditation, and physical exercise. So Oriental medicine, like we said before, is also known as the traditional Chinese medicine, has indeed a rich history and a holistic approach to health and well-being. And the principles are deeply rooted in the balance of, like I said, yin and yang, and the opposing forces of our body. So anyway, the choice between Oriental medicine and Western medicine is still, out there, but definitely it's on individual preferences, but keeping the two together would be beneficial to your health and to your wellness. Some people find that combining elements of both systems provides the best results. Anyway, so it's entirely up to you, but hey, we have this great school right here, and we have this great opportunity in our community. So I'd say take a look at it and look at it from a more holistic approach to healthcare. So thank you very much for joining us today. Please be safe and be well. And until next time, this is Doris Bauer, your Philippine Nurse host, signing off for now.
is your Filipino radio experience in Las Vegas. PHLV Radio.